Hello, my name is Mary Going and I'm a Self-Management Support Coordinator for Long-Term Health Conditions working with the HSE. I'd like to talk to you about self-managing your COPD. I'm going to cover 5 topics. Number 1, I'll explain what a long-term health condition is and describe what we mean by self-management. I'm also going to talk about the importance of understanding your COPD. Number 2 is about keeping as healthy as possible and looking at ways that you can do this. Number 3 is about minding your mental health. Number 4, I'll show you a self-management plan as it's a very useful guide to managing your symptoms. And finally, number 5, I'll describe the Living Well programme, which is a free group programme which helps you to develop the skills and confidence to live well with your COPD. So what do we mean by a long-term health condition and self-management? COPD is a long-term health condition which means it can be treated and managed but not cured. While having a long-term health condition can bring a lot of physical, emotional and social changes to your life, the good news is that there is a lot that you can do to improve your health and live well. Knowing all you can about your condition, your symptoms, your medications and how to cope with flare-ups can make your day-to-day life easier. Your medical team may be the experts on your COPD, but you are the expert on you. Teamwork between you and your healthcare team is important. The treatment plan that works best for one person with your condition may not work best for you. Nobody knows more than you do about your body, your feelings, your actions, and how your health affects you. Every day you do things to manage your COPD when you're not with your doctor or other healthcare professionals. This is known as self-management. Self-management involves making choices about your health and lifestyle. Good self-management means a better quality of life for you. It means living as well as possible with your COPD. Examples of good self-management are stopping smoking if you're a smoker and avoiding passive smoke, learning about your COPD, monitoring signs and symptoms of your COPD, taking medicines as prescribed, being more physically active and improving how you communicate with your doctor or healthcare professional. Knowledge is power. The more you know about your COPD, the more you understand it, the more control you will have over your condition. Your healthcare team can help you understand your condition and how you can live well with it. Talk to your GP and practice nurse, your respiratory team, your local pharmacist to learn about different aspects of your condition. Attend all your GP and respiratory team appointments and bring a list of your questions to get the most out of your time. If your appointment is by phone or online, prepare in the same way. Take notes during the appointment so you can remember the information discussed. Bring someone with you for support if you wish. Really try to make the best use of your visit. Don't ever hesitate to ring your GP, especially if your symptoms are getting worse. Getting help early will keep you out of hospital. COPD Support Ireland have an advice line to support you. If you have any questions about your COPD, call 1800 83 21 46 and a specialist nurse will put your mind at ease. Learn about the medication prescribed for you, why you're taking it, when to take it and how to take it. Medication includes tablets, inhalers, nebulizers, oxygen, patches, injections and any other prescribed products. It's important that you take your medication as instructed even when you are feeling well. Make a list of all your medicines. This is important information to give to healthcare workers if you become sick. You can ask your pharmacist for a copy of your medications or you can get a medication list on safermeds.ie and fill it in yourself. If you don't have a list, keep all your medication together in a bag and bring the bag with you when you have a medical appointment. Always have enough medication. Ensure that you have 1 month's supply to hand so you don't run out unexpectedly. If you have a backup prescription for steroids and antibiotics, known as a rescue pack, make sure that you have your supply of these and that they are in date. You can order your medication over the phone from your pharmacy. If you can't collect it, inquire if they offer a delivery service or ask someone you trust to collect for you. Take your inhalers as prescribed and make sure they are not empty. Check that you're using your inhaler correctly. Your respiratory team will regularly check this, but you can get into bad habits, so go to www.copd.ie for demonstrations of correct inhaler technique. If your inhaler requires a spacer, it is recommended that you use one to ensure best medication delivery. A video with instructions on using a volumatic inhaler can be found on copd.ie. As many of you know, pulmonary rehabilitation is a programme of exercise and education for people with long-term lung conditions. If you haven't already attended a programme, ask your healthcare team about it. It's really important to keep exercising after completing pulmonary rehab so that you maintain the benefits. Some people find it helpful to join a support group as they have weekly exercise classes. COPD Support Ireland has a list of groups around the country. These groups meet weekly for exercise, education and a chat. It's also an opportunity to talk and learn for people who have the same condition as you. During COVID-19, they are meeting online. To find out about groups in your area, go to copd.ie or phone 086 041 5128. Keep yourself as healthy as possible. Everyone benefits from a healthy lifestyle. Making your home a smoke-free zone should be a key priority. If you or someone in your family is a smoker, look for help to give up. Never stop trying to give up. No matter how long you have been smoking, there are still great health benefits in stopping. Stopping smoking will improve your cough and phlegm production. It will also slow down the rate at which your breathlessness will increase. Go to quit.ie or to your GP, who will be able to recommend medications and supports to help you or your family to stop. Be as active as you can be. Engaging in physical activity is essential to improving your breathlessness. The more you do, the more you'll be able to do. As well as improving your lung health, being physically active also helps your body stay strong and flexible, improves your balance and coordination, and reduces stress and anxiety. Pace yourself. Pacing is about carrying out activities over time and not carrying them all out at once. It's better to do a smaller amount every day rather than tiring yourself by doing too much at one time. For example, instead of exercising continuously for 30 minutes, break it into 3 bouts of 10 minutes at a time. Everyone's ability and condition is different. Pay attention to your body and how you are feeling when doing regular tasks. Eat a healthy diet. Eating well is important for everyone, but especially if you are living with a long-term health condition such as COPD. Eating healthily can help you to feel good, give you more energy, and stay at a healthy weight. A healthy, nutritious diet provides energy, including the energy you need to breathe. It promotes a strong immune system to help you prevent and fight infection. Try to achieve a healthier weight. If you are underweight or not eating enough, this is not good for your COPD. You are likely to feel tired, and this can make it more difficult to do everyday things. If you gain a little bit of weight, you'll be less prone to infections and find it easier to recover if you do become unwell. If you need help to achieve a healthier weight, talk to your GP or dietitian. Eating small amounts regularly is often the first step. On the other hand, if you are overweight, your lungs and heart have to work harder. This can make breathing more difficult. Ask your GP or dietitian for support. It's important to lose weight gradually by making small changes to your diet and exercise regime instead of going after a crash diet or quick fix. Mind your mental health. The emotional effects of a long-term health condition can be difficult. Managing your COPD can increase the stress of everyday life. It's not unusual to feel down or anxious when living with COPD. Caring for both your physical and mental health can help you cope better. Don't bottle things up. Talk about your feelings. Talk with people you respect and trust, such as your family, friends, or your healthcare team. Look for help if negative feelings interfere with your ability to enjoy life. You may find that taking part in a programme, such as Minding Your Wellbeing, will help you. This HSC programme is free and provides simple tools and guidance to develop and maintain a positive outlook by looking after your mental health and well-being. It consists of 5 20-minute videos that can be accessed on yourmentalhealth.ie. There are other supports also, such as the Alone helpline on 0818 222 024, Aware on 1800 80 48 48 and the Samaritans on 116 123. Your self-management plan. The COPD communication card and the COPD self-care plan are two tools that will help you to self-manage your COPD. The COPD communication card helps you keep all information relevant to your COPD in one place. Bring it with you to every healthcare appointment and ask your healthcare professional to fill it in. It also contains a COPD self-care plan. This plan will help you to manage your condition. Talk to your family and your GP about it when you're well, so that you know what to do if you become unwell. Monitor your symptoms and know what is usual for you. It's important that you learn to recognise the signs or symptoms that tell you when you need to look for help. This will help in assessing if you need to alter your medication or start treatment early for an exacerbation or flare-up. The plan works to a traffic light system of green, yellow, orange and red and gives advice depending on your symptoms. You want to stay in the green part as much as possible. And here are 5 things to help keep you well and in that green part. Have a daily routine. Take your inhalers and medicines at set times every day. Exercise at a regular time. Plan your meals in advance and try to eat at roughly the same time every day. Get your vaccinations. Preventing flu, pneumonia and other infections is an important step in self-management. Ask your doctor or nurse about vaccines recommended for you. Know your COPD triggers in order to avoid them where possible. For example, avoid smoky environments and pollutants like dust, smog or foggy weather. Keep your home smoke-free. This is so important for keeping yourself well. Avoid infection. Think about COVID-19 and how we reduce the risk of infection through proper hand washing, coughing etiquette, physical distancing, avoiding crowded indoor spaces and staying away from people who are sick. There's so much learning in this about how to avoid infections. Keep these in mind to keep viruses away. Have a hand sanitizer with you all the time, in your car and in your handbag. Keep all your equipment, such as nebulizers, clean by following the manufacturer's cleaning guidelines. Wash your hands with soapy water before and after use. The self-care plan also gives advice about what you should do if you're having a bad day, the yellow zone, what to do if you're feeling unwell, the orange zone, and what to do if you're feeling very unwell, the red zone. The red zone is for when you're getting worse despite taking your rescue medication. Don't delay. Phone your GP or your GP out of hours immediately. Go to your hospital emergency department if your GP is not available. If you're short of breath at rest, have chest pain or confusion, this is an emergency. Call 112 or 999 and ask for an ambulance. The self-care plan and the communication card are available to download on hse.ie/self-management support or ask your respiratory team. Living well. Doing the things that keep you well may mean that you need to make changes to your life. Making changes to your life can be hard, but there is a programme to support you to make these changes. Living Well is a free evidence-based group self-management programme for adults with long-term health conditions. It supports people to develop practical skills and confidence so they can manage their health condition better and make changes for a healthier life. The Living Well programme supports you to develop the skills which will help you to live well with your COPD. So what does Living Well involve? Living Well is a group programme that runs for 6 weeks. It is normally delivered face-to-face in community settings, but can be delivered online, as it has been during COVID-19. There is 1 workshop a week which lasts for 2.5 hours. 2 trained facilitators run the workshops each week. At least one of the facilitators lives with a long-term health condition. Some people taking part in the workshops may have COPD, but others will have different conditions. The workshops are delivered in a relaxed and friendly way so that all participants can learn from each other. You can also share experiences of living with COPD. A key part of the Living Well programme is setting goals that you want to achieve. Each week you learn how to reach these goals by making an action plan. You also get support from the group to problem solve. Living Well is for adults aged 18 and over, and it is suitable for people living with a long-term health condition such as COPD or caring for someone with one. Over the course of 6 weeks, the programme covers topics such as using your mind to manage symptoms, action plans, dealing with difficult emotions, decision making and medication management. To find out more about the programme, go to hse.ie/livingwell or to HSE Live on 1850 24 1850 or email them on hselive@hse.ie. So to conclude, I have talked about understanding your COPD and taking your medication as prescribed. I've shared some tips on living a healthier life, including the importance of stopping smoking if you're a smoker. Minding your mental health is vital, and I've signposted you to some resources that can help you. I've shown you the COPD communication card and the COPD self-care plan, which are really useful tools in self-managing your COPD. And finally, I've given you details of the Living Well programme, which will support you to develop skills to live well with your COPD. Self-management is not about going it alone. It is about you being in control of your COPD and having the support of your team of healthcare professionals to be able to do so. So that's a quick guide to self-managing your COPD. You will also get information from reliable organisations or websites such as asthma.ie, copd.ie, hse.ie/COPD, hse.ie/self-management support, hse.ie/livingwell, quit.ie and yourmentalhealth.ie.